You've been sounding the alarm over potential federal funding cuts. However, in this year's budget, are we not actually realizing a $1 billion increase in federal funding for the Department of Health?
So you mean in the FY26 budget?
In Medicaid funding.
I would have to defer that question to my colleague in Human Services.
All right. For the purpose of discussion, our calculations through the Office of Legislative Services would indicate that there is an additional $1 billion flowing into the state of New Jersey in Medicaid funding this year. I am aware, in having the opportunity to speak with you and to listen to the testimony before the Senate, that you have concerns about the requirements of the One Big Beautiful Bill, H.R. 1, in which there are certain requirements imposed upon the state of New Jersey effective October 1, 2029, specifically to reduce the error rates in Medicaid reimbursement. Am I stating that correctly, Commissioner?
Yes, sir. I believe so.
The fact of the matter is, if New Jersey is able to comply with the federal requirements to reduce its own error rates, we may not appreciate any loss at all in Medicaid funding when we reach that point at which that examination takes place. Would you agree with that as well, Commissioner?
Assemblyman, the Department of Health does not administer the Medicaid program, and so I would defer any questions about the Medicaid program and the impact of H.R. 1 directly on the administration of the program to the Department of Human Services.
I appreciate that. And oftentimes there is crossover, to your point. I think at one point they were actually one department before being split off into Human Services and Health. I think that happened about 10 years ago, if I'm not mistaken. And in terms of the work requirements that are being imposed, I was very concerned to hear you mention the potential for up to 370,000 people currently receiving family care benefits would run the risk of losing their coverage if they are not compliant with the requirements of H.R. 1. Is that accurate?
What I said was is that we know that families are potentially going to lose coverage as a result of changes in policy in the Medicaid program. My specific focus in my comments is on the impact that has on families. If people don't have access to health care insurance, that impacts their ability to be able to access health care. And my department's focus is on ensuring that residents have healthy outcomes. And the focus here is ensuring that we do, as a state, everything possible to ensure that residents are able to access health care.
Totally agree with you, Commissioner, that we want our residents to be insured and to have quality health care. I think we can all work together on that. But there are requirements which are contained within H.R. 1 that we have to satisfy. And if, in fact, the state of New Jersey and its residents are compliant with either the new work or volunteer or school or caregiver requirements imposed in the bill as of October of next year, then in fact there could very well be no loss in coverage. Would you agree with that, Commissioner?
Assuming, again, I would defer the questions about the projections around loss of coverage to my colleagues in Human Services.
I'm a little bit confused, Commissioner. We are having a discussion about the potential loss of coverage for 370,000 people, but you're not involved with preventing that loss?
Assemblyman, thank you for the question. So our department works with Human Services to administer health and human services across the state, but we do have distinct responsibilities. The Department of Human Services is independently responsible for administering the Medicaid program. Our department is focused on the parts of the stability of our healthcare system through efforts like the charity care program that support our hospitals who are delivering care to people who are not unable to afford it. And so I provide the coverage loss as context to the discussion today about the Department of Health's budget, because our healthcare systems are set to, if people lose coverage, whether it be public coverage through Medicaid or Medicare, or whether it be private coverage or ACA coverage through the subsidy or on the exchange, the downstream effect of that is two things. One, people who don't have coverage anymore will avoid care and they will get sicker, which is the worst thing we want to happen, and they will need more care. The second thing that happens is people will seek care at our hospitals and not have a payer source. And the result of that is that impacts the ability of the financial status of our hospitals. And so the work that we do to monitor the health of hospitals' finances, as you know, we have a number of hospitals across the state that are having difficult financial economic conditions. That's the role that we play as a department, is to support that part of the equation. The administration of the Medicaid program, questions about their preparedness for the new measures and HR 1 really should be directed to Commissioner Cha and Human Services.
I appreciate that, Commissioner.
Chair, one point of order.
Yeah.
Does the Assemblyman have questions for the Department of Health?
Yes.
Yeah, I
Let's
think
just
I'm-
move on from the from the HR one, because clearly it's not for DOH to answer.
I would suggest respectfully that HR 1 certainly impacts Department of Health as well as the Department of Human Services. And I think we have a collective mission as a state to ensure that New Jersey doesn't lose funding in either department or through the hospitals. And to your point, Commissioner, we don't want people showing up in the emergency room for their health care.
Sure.
We want them to enjoy preventative care, have a doctor they can turn to for both preventative care and for acute illness. Charity care is increasing in this year's budget. We presumably would be looking at much more significant increases if, in fact, people were to rely upon hospitals as their first contact in their healthcare journey.
Assemblyman Rumpf, DOH has already asked and answered the same question you've asked 3 times. I've given you leeway to ask it, but I think we should just move on with a different question.
Which I am leading to, Madam Chair. Hospital funding, Commissioner. That is being cut in the Department of Health budget by approximately 50%, if I'm correct, down to 112 million. Is that accurate? $103.7 million reduction in funding for hospitals proposed for the upcoming fiscal year.
Assemblymember, I don't have that exact number. I can tell you very plainly that the overall funding for hospitals in the core health Department of Health budget through our subsidy programs and charity care is essentially it's increasing by a small margin because of the increases in charity care. So I'm not sure if you're speaking specifically to maybe the one-time grants that were awarded to some facilities, but I'm happy to get back to the chair if you want to share what you're looking at with me, and I'm happy to be able to explain it in more detail.
I appreciate that, Commissioner, realizing that we receive the benefit of OLS figures as well as Department of Health figures, but it would appear from the figures that I'm looking at that we are looking at that reduction of 103.7 million, which equates to 53.2% in hospital funding. Can you talk,
again,
Commissioner?
Assemblyman, just to be clear, our department supports our hospitals with well more than $200+ million, so it would not be 50% a 50% reduction. But again, I'm happy to take a look at what you're looking at so I can better explain.
I appreciate that. Let's, if you don't mind, turn the page a little bit and speak, if you don't mind, about the state's 4 psychiatric facilities that you had mentioned in your opening remarks. There had been a request by the Department of Health, I believe, for $320.4 million in additional capital funding to support needed improvements at the 4 psychiatric hospitals. And that would include, for your benefit, Commissioner, I'll just run through some of the major items. $63.4 million in HVAC, $50.5 million in electrical system upgrades, $23.6 million in fire safety, $56.3 million to allow for the demolition of vacant buildings, $8.6 million in elevator replacement, and apparently critical roofing replacement needs of $4.4 million. However, the sum total of what the Department of Health is proposing in this budget is $479,000, which is 0.15 of the overall request to fix just one leaking roof at Ancora. My concern on behalf of the 1,200 needy people that reside in those 4 psychiatric hospitals is that we're ignoring capital improvement needs which have an urgency and which are exploding exponentially in cost as we go year by year and ignoring what we need to do. Do you have any comment on that, Commissioner?
Yeah, Assemblymember, thank you for the question. As you noted, we are caring for some of the most vulnerable residents in our community, and we do so with great pride and passion. Our team members at the psychiatric hospitals are delivering care 24/7 to provide round-the-clock, high-quality care to those residents, and
Certainly.
we're making, I would say, good progress in doing better at delivering that care. As with any healthcare facility, as facilities age, there's obviously needs, but I'm certainly happy to follow up with through the chair and later discussions as we talk about the state's capital budget, which is separate from today's discussion about our operating budget.
Commissioner, in your opening remarks, final questions, if you don't mind, Madam Chair. You were talking about the expansion of harm reduction centers. $4.5 million in departmental funding, but $118.6 million from the opioid settlement funds are what you referenced in your opening remarks to expand harm reduction over the next 5-year period. Do you have any detail on what is meant by the expansion of harm reduction, Commissioner?
Certainly. The expansion is mostly creating additional access points and opportunities for residents to be able to access those critical services. The work of harm reduction, as I mentioned earlier, is about giving every resident that's struggling in our state with substance use an opportunity to achieve recovery. And so those teams are working to provide harm reduction tools to residents, and the expansion is an expansion of locations and opportunity points for individuals to access those services in the communities that need them most.
Commissioner, I think most would agree that an opportunity to secure recovery is something that we all can agree upon. I think a little bit more divisive is how we get there to recovery. Is it fair to say that the harm reduction centers that we're talking about include needle exchange or syringe exchange access points as well?
Yes, sir.
And do any of those harm reduction centers include safe injection sites?
Safe injection facilities would not be legal in the state of New Jersey.
Glad to hear that. Is there an ongoing debate, if you will, or consideration as to what is appropriate and what is not appropriate with respect to harm reduction? Or have we arrived at the point in New Jersey where there is a standard methodology and every harm reduction center looks alike in terms of what it might or may not include?
Yeah, Assemblymember, as I mentioned in my opening remarks, we are fortunate to be seeing progress on the devastating impacts of the opioid epidemic across our state and country. Too many families are grieving the loss of young people and loved ones who have unfortunately died as a result of overdoses, many of which were preventable that could have been reversed. And so our harm reduction centers are working to ensure that residents have access to those tools that we know are effective. It's not a debate about whether or not it works or not. We know those tools work. And so those tools allow our residents to both be protected from infectious diseases like HIV and hepatitis. It allows individuals to have access to naloxone so that they're able to overdose, to reverse overdoses and know how to reverse an overdose if they see someone experiencing one. And so those set of services that are available at those centers across the state are delivering those valuable resources to save lives in New Jersey.
The commissioner referenced throughout his remarks HR 1. He took a question from the majority on HR 1. When the minority asked the commissioner
we
about
can
HR 1.
get to your questions
Hang on,
after.
I want to make sure I'm prepared,
Okay, but-
though, because my colleague was advised to move on from HR 1. If I ask about HR 1, am I going to be ruled out of order
No,
or
he's
not?
asked the same question 3 times, and I gave him that leeway. And he tried to basically change the question three different ways.
On HR 1.
And, correct,
But
regarding
is
the
HR 1
budgeting.
germane to our discussion today?
On Medicaid specifically.
Is Medicaid germane to our discussion today?
No, because
It's
this is
not?
Department of
With the
Health.
Commissioner of Health?
The commissioner just said that's something that you have to ask the different department for.
Okay.
Right? So,
I mean, it was referenced
again,
throughout his remarks. I just want to be clear. I want to be
Yes.
prepared for the questions that I have.
please prepare for them. But again, I've given Assemblyman Rumpf like many leeway, including your last question, which has led to 4 more questions. So let's move on. We'll ask somebody else who
And
else
Medicaid
has
is off the
questions.
table.
Yes.
Okay.
And-
I'm concerned about that.
Respectfully, I do disagree with the commentary, because the commissioner himself referenced New Jersey losing billions of dollars by virtue of HR 1. I think it's
I
a
already asked
point.
your question, Assemblyman Rumpf.
I think it's a
Please.
valid point for discussion, Madam Chair.
Again, the commissioner will provide you with any information through the chair, but I think, again, you've asked the same question 4 different ways, and he's answered that it's not his department that's in charge of Medicaid.
I disagree respectfully. Commissioner, thank you. I look forward to continuing discussion.
Thank you.